If you are one of the 3 million people in the United States suffering from sciatica, you already know that everything you do is affected, from loading the dishwasher to shoveling the driveway. There are some things you just can't do, but there is help, a solution to pain from sciatica, and Dr. Miller from Total Health Chiropractic is here to explain what the solution for you could be. Good morning, doctor.
Hey, Todd.
Sciatica is a word that we hear the sciatic nerve, right? Is that where sciatica comes from? What does that mean?
Well, there's a lot of confusion. A lot of times people get leg pain or, shooting pain down their leg, and they go to their doctor and they say, well, that's sciatica, and send them right to physical therapy or take a few drugs to treat that. But the confusion is there's actually 5 different nerve levels in our lower back that branch through the hip and buttock area and form the sciatic nerve, which is actually the largest nerve in our body. It travels down our leg to our foot. So sciatica just means inflammation or irritation to the nerve.
Okay.
But if you really want to get that fixed, you have to figure out what levels are irritated and actually what's irritating those nerves to cause that sciatic pain. And unfortunately for most patients, it is due to a bulging or herniated disc in the lower back.
Yeah, it's a pretty common cause for that. So if we're going to break it down to sciatica 101, to bring here's kind of what we just went through, right?
Mm-hmm.
The largest nerve in the body, and its bulging discs can be the most common cause, or one of the most common causes of why you're getting that pain. A lot of people might not think a pain in your knee or your leg or your buttock is actually caused from their back.
Exactly, and sometimes it's in the groin, sometimes, like I said, it's shooting pain, sometimes it's not that, it's numbness and tingling down the leg. Other times patients aren't in a whole lot of pain, but it's affecting the function of the muscles in the leg or the hip. So the nerves stem from the lower back, and that's where it has to be treated. But if all you're doing is trying to mask the symptoms, the problem persists.
And that's what we were talking about when we started this, was a solution, not just a masking the pain. The common treatments you're talking about are shots, drugs, opioids, things like that?
Yeah, a lot of them, unfortunately, are to just treat the symptom, not actually fix the cause of that. And so, a lot of times it is medications, physical therapy. As it starts getting more serious, they'll go to pain clinics and be getting shots in their hips or their back. For worst case scenarios, they might even face back surgery. But these are very invasive treatments. There's side effects with those. And a lot of times patients have to take time off their life, whether it's work or hobbies with their family or chores, to get those treatments done. And it continues and persists or comes back because they're not actually fixing the cause.
There's a better option, this medical equipment that you have at Total Health Chiropractic, the DRX 9000C. Can you tell us what that is?
Sure, Todd. So this is a medical device that we use in our office to treat a lot of these degenerative conditions of the spine, but it's a way to effectively treat and correct degenerated discs, the bulging or herniated discs that I mentioned, sciatica. It's a great treatment for that, and even things like facet syndrome or spinal stenosis and pinched nerves. But it's a very gentle and specific way with the aid of computers to just stretch that injured area of the spine that's irritating the nerve, and it helps to regenerate the discs. So our patients are really getting great results and enjoying their life once again, because we're fixing the cause of that, not just trying to mask the pain temporarily.
And you mentioned patients. I know that there are a couple. There's Cheryl and Gary who have been through what you've been able to do for them, and some testimonials from them. Who's there? Cheryl right there.
Sure, and they both had back and leg pain, but it affects people in different ways. So for Cheryl, she really enjoyed traveling, and with a lot of the traveling, that's going to involve walking to different sites, and she was very concerned because she was hunched over in pain, her back and leg hurt, she wasn't able to walk very far, constantly having to stop and take a seat to rest before she can go again. And she had tried, I believe, physical therapy as well as chiropractic adjustments, wasn't really getting the relief she was looking for. And when we met, we confirmed what her problem was due to degenerated discs in her back, and she was a great candidate for decompression, and we're happy to help her.
There's Gary, and Gary's got a smile on his face too.
So Gary had back and leg pain that was actually keeping him up at night, so he was losing sleep. He's a very active man that runs a hardware company, or hardware store, and he wanted to be able to run the business, enjoy his wife and grandkids, and not getting the sleep or being able to function really put a damper on his life. And he also tried many other treatments before seeking us out, and so we were happy to get his problem fixed and get him back to work and enjoying his family again.
And I notice you've got a spine here with you. I mean, we saw an image of it on our screens, but where exactly does the problem tend to start?
Well, Todd, as I said, there's 5 different nerve levels down here through the lower back, and then these nerves will branch around through the buttock and the hip And they actually, as you get down here, form together into the sciatic nerve, which is actually about as big as a man's thumb. There's so many nerve fibers going down the leg. So, you know, it could be misalignments, it could be the disc problems, but when these nerves get pinched, you know, it can be a very painful and limiting type of life to live.
Who knew that the nerve was that big, as thick as a thumb? You're saying that's a lot of nerve fibers.
Absolutely.
That can be affected. So obviously we'll talk more about this in detail at a great seminar that you have coming up later on this month.
We do, Todd, because there's so much confusion with this and many people are struggling. I'm going to be offering a free seminar at our presentation room in our office on East Paris, and it's going to be Tuesday, February 25th at 6 p.m. You are able to bring a guest if you would like, and it is free, but we do fill up quickly, so make sure you call and schedule that, get your spots reserved. But if they can't make the seminar or just looking for relief quicker than waiting, they can call our office today, and we have a great special for them.
That's true.
To meet with me, consult, we'll do an examination and start getting to the root of their problem and see if they're a candidate for our decompression program. We can help them.
$99 gets you the consultation, the examination, and the report. Find out if you are a candidate for the DRX 9000. Many people, they say once they're using this piece of equipment, it's the most relaxing thing that gets them the results. Some people, you say, even take a nap while they're on this, getting stretch out and getting that, what is it, the buffer rehydrated?
Yeah, it regenerates the disc. So they start to rehydrate and thicken up. They get more like a shock absorber again. And if they do have the bulging or herniated discs, it actually retracts them in off the nerves. So
that's what we're looking for, right? That kind of relief. If that's you or someone you know, make sure you reach out, thchiro.com, or call 616-828-0861 right now to schedule your appointment. If the lines are busy, keep on trying. They want to see you to help you and that pain.